Do you want to reduce wrinkles, blemishes, or improve skin texture? Do you? Then this video is for you. But first, subscribe to our channel, click on the bell to activate notifications, leave a like to say you liked it. I'm sure you've heard of retinoic acid. If you haven't, I'll explain what retinoic acid is. Retinoic acid, or tretinoin, or retinol, is a substance derived from vitamin A. It is a compound that has been studied extensively to reverse, even partially, the effects of aging on the skin. It doesn't matter why you're getting older. Sometimes it's the sun, sometimes it's too much worry, sometimes it's a bad diet. Retinoids are powerful substances because they act on the cell's nuclear receptors. But when should I use it? Retinoic acid is mainly indicated for signs of photoaging, i.e., people who are aging due to the sun. So people with those fine wrinkles, hyperpigmentation, i.e., dark spots on the face, freckles, roughness, uneven texture, as well as treating the damage caused by overexposure to the sun's rays. It also helps to stimulate collagen production. When used in high concentrations, it even helps to treat stretch marks, those little striations that are still red, i.e., in the early stages of the process. Retinoic acid is also used to treat acne, i.e., pimples. It doesn't solve excess oil on the skin, but it does have a long-lasting effect after treatment. Retinoic acid balances the keratin inside the pores. In this way, it prevents the pores from clogging and thus helps to prevent acne, pimples. It also improves skin texture and helps improve pimple scars. Guys, just to tell you, I've used retinoic acid a couple of times in my life, and one thing I've promised myself is that every year I go to the dermatologist for a cycle of treatment with retinoic acid. Look, it gives you an upgrade. It improves your skin in an impressive way. You go to the dermatologist, especially me who rides my bike a lot, and you come in full of spots, but the darker skin, which I'm exaggerating, doesn't have so many spots. Here too, I've been using it for about 6 months, but after about 4 months of using some kind of product based on retinoic acid, it improves a lot.
Hey you guys, are you enjoying our content? Why I'm asking this? Because according to our channel analysis, 97% of the people who watch us are not subscribed to the channel. Do you believe this? So I sincerely ask, if you have liked our content, subscribe to our channel. Let's make this content reach everyone around the world, and let's make this a healthier world, okay? So subscribe our channel and God bless you.
How do you use it? Retinoic acid can be found in the form of a gel, cream, lotion, or serum. And when it's more concentrated, it's applied in the form of a peeling. In other words, you go to the doctor, the dermatologist, the esthetician, or the physiotherapist, apply it on the spot, leave, and then take it off at home. In the latter case, when it's more concentrated, the dermatologist sometimes applies it once a week. And this type of peeling is very suitable for people who have melasma, those darker spots on the skin. It is also widely used to control pimples, oiliness, and improve fine wrinkles. Deeper wrinkles can only be solved with Botox or fillers. Remember that Botox only improves expression wrinkles, those when you frown or squint, okay? Retinoic acid is also widely used in cream form, and its dosage depends on the dermatologist's recommendation. How you apply it and how often you apply it will depend on the dermatologist. For example, my dermatologist asked me to apply it 3 nights a week. I would apply it, sleep with it on, then take it off the next day and put sunscreen on if I was going to be exposed to the sun. But some people use it every day, others once a week. It depends on each skin. That's why you need to see a dermatologist to receive all the indications. The ideal amount is the size of a pea on each part of the face, and you spread it on. You have to be very careful not to apply it to the corner of your mouth, nose, or eyes, as it can irritate them. There are cases where you apply it, leave it on for 20 minutes, wash it off, and moisturize. Each case is different. And in some cases, the concentration can be stronger, and you'll see the skin peeling off in the first few days. You're getting rid of the old skin. Now, when that redness, that itchiness, that irritation is too great, you have to contact your doctor. That's why it has to be done under medical supervision. There are people who have no tolerance to retinoic acid, so your dermatologist will often ask you to stop the treatment, put on moisturizer, and start more slowly. Then you get used to it, and it intensifies the treatment again. Then, as the acid makes the skin more sensitive, you need to use sunscreen the next day if you're going to expose yourself to the sun, at least a sun protection factor 30. The length of treatment will also depend on your case. I personally used it for 4 months. In a year, I use it for 4 months. Then I take my time. I go 4 years without going back to the dermatologist, but I'm not an example, am I? Not in that respect. However, prolonged use can lead to breakouts on the skin. So it's best to set the time with your dermatologist and be very careful not to expose the skin where you applied the retinoic acid to the sun the next day. If you're going on vacation, going to a hotel, going to the beach, you can't do this treatment. If you ride a bicycle or a motorcycle, you have to be very careful. Otherwise, you'll burn, you'll turn red, and you'll get spots that could be permanent. And what are the contraindications? Retinoic acid cannot be applied to inflamed skin, eczema, psoriasis, or sunburn. You have to be very careful because some people don't realize they've been sunburned. You just get that little red thing and apply retinoic acid. It is contraindicated in people who have skin infections such as herpes, bacterial infections, or infected pimples. And it should be avoided by people who have rosacea, just as it should be avoided by people who work outdoors, gardeners, people who work in the sun. I don't know, there are various professions, traffic wardens, and if you're pregnant, don't use it either. So it's forbidden during pregnancy. If you're breastfeeding, you can use it after 6 months. Since by this time the child is already using other types of food, it will absorb fewer substances that might be in breast milk. So what will you notice after 45 days of using retinoic acid? Improved wrinkles. Already in the first month, you don't even need 45 days, you'll notice it in 30 days. Skin whitening is very visible. And you notice that your skin is prettier, more vibrant, with a clearer appearance. So I ask you, have you ever used retinoic acid? Have you had any experience with it? How do you feel about it? Have you had great results or not? Our skin, it's the first thing others sees really. So it doesn't hurt to take a little care of it and live healthy, live with passion, with God in your heart. Bye guys.